One mobile phone went off in the press conference. So I'll repeat that. 13 new cases, all linked. 8 were in quarantine during their infectious period. 5 were infectious in the community. We have 10 people hospitalised with COVID-19 and 1 remains in intensive care. Yesterday, 3,650 tests. We again note that there's very low wait times across our many testing clinics in the ACT, and so please come forward for testing if you have any symptoms. ACT Police have been active in compliance, 526 traffic stops and 17 directions to leave the ACT. Policing have received 88 compliance complaints and issued 2 cautions following investigating those complaints. Access Canberra attended 117 businesses yesterday, monitoring the introduction of the new click and collect model around the ACT and reported a very strong level of compliance. Now, in the last 7 days, more than 31,000 COVID-19 vaccine doses have been administered. More than 14,000 first dose bookings have been made at ACT government vaccination clinics, and more than 25,000 people aged 16 to 29 have registered with the My Digital Health Record system since those registrations opened up for that age cohort on Monday. Now, in terms of the totality of our vaccination program, some really encouraging statistics to report. 223,621 ACT residents had received at least 1 dose of the vaccine as of yesterday afternoon. That equates to 65% of our 16+ population. But the more important figure is 61.5% of our 12+ eligible for vaccination population. There are 141,791 ACT residents fully vaccinated. That represents 41.2% of the 16+ population and 39% of the 12+ population. So a reminder that the ACT government's intention with our vaccination program is to vaccinate as many Canberrans as quickly as possible. And with the available vaccine supply, we intend through AstraZeneca, increase Pfizer, and when Moderna comes on in pharmacies in about a month's time, to have a nation-leading vaccination program, both in terms of the proportion of our 12+ population that we have vaccinated and how quickly we are able to do it. And that's why we have stood up additional mass vaccination capability through the AIS arena. So I just repeat what I said yesterday, that the AIS arena will commence its operation on the 3rd of September. It can do up to 24,000 vaccinations in a week. And this will allow us to deliver more Pfizer to more people more quickly. That's the reason for standing up this big new facility. So in summary, 13 new cases, all of them linked. This means we know how or where they became infected. 10 are now hospitalised. Some have been released from hospital, but we've had some new cases come in to ACT hospitals. And the 1 person we've been talking about for some time remains in intensive care. And again, I take the opportunity to thank the staff in the intensive care unit and to send our thoughts and love to the family of that individual in intensive care. I'll now invite Dr. Coleman to provide a further update on new cases and epidemiology, and then we'll be happy to take questions. Thank you.
Thank you very much, Chief Minister, and good morning, everyone. As you know, I'm Karen and I'm the ACT Chief Health Officer. As the Chief Minister has said, since our update yesterday, we've recorded 13 new COVID-19 cases, which brings our total cases for this outbreak up to 250. The good news is that 20 of our cases for this outbreak have now recovered, which leaves us 230 current active cases. So of the new cases today, I can confirm that out of the 13, all 13 can be linked to known cases or ongoing clusters. We know that 12 of these 13 are actually household contacts and the remaining one is linked to a known cluster. Out of the 13, 8 were in quarantine during their whole infectious period, therefore posing no risk to the community. Of the 5 remaining, all were infectious in the community for at least part of their infectious period. We continue to have 10 people in our hospitals, and as the Chief mentions, one of these remains in ICU and continues to receive intensive care support. Of these 10 patients, 4 are under 40 years of age and 6 are over 40 years of age. All patients are unvaccinated. Since our last update, we have just over 800 self-identified close contacts, so this number has dramatically come down from a peak last week of somewhere over 18,000 and now over 3,000 casual contacts. We now have 181 current exposure locations dispersed across the ACT. So no matter which region you live in, it's really important to keep up to date with that information on exposure locations that we update twice a day on the ACT COVID-19 website. As I mentioned yesterday, outside of our public sites of transmission, we do continue to see clusters and the broader impacts of COVID-19 on some of our most vulnerable members of the community. We now know that a confirmed case of COVID-19 has visited Ainslie Village while unknowingly infectious, and therefore Ainslie Village will be listed as an exposure location on our website later today. So please check for the specific dates, times and classification a bit later today. Our multi-agency response team moved very quickly yesterday afternoon to communicate directly with residents in Ainslie Village, as well as put in place support mechanisms while testing is being undertaken. Several residents have already been tested, and our team, along with our non-government community partners, will remain on site to ensure that residents have access to any support they need. So with respect to our general overall outbreak analysis, we continue to see a slight increase in the 18 to 44-year-old age range, but no major changes. And this is due to the transmission that we are seeing in our household contacts and workplaces as we move forward, and this outbreak comes further under control. We continue to have 11 public sites of transmission. 5 new cases have been confirmed overnight linked to the Bright Bees Early Learning Centre. Now, this includes 1 of today's new cases, but 4 previously confirmed cases with additional information have now been linked to this cluster. Our total for this cluster is now 26, with a lot of these now household contacts, indicating that next generation of transmission. And we now have a total of 5 cases linked to the Murchie Indian restaurant, and this has been upgraded to a close contact site. So this is a reminder, please check the website, and if you have been to any of these sites during the dates and times identified, please get tested and do what the website is asking you to do. And just to note, we continue to see cases coming from onward transmission in the home and workplace, and not necessarily from direct exposure to specific locations, which, as I talked to yesterday, is not unexpected and is part of us resolving and moving forwards on this outbreak. Testing numbers were slightly higher yesterday, so thank you to everyone who went out and got tested. As always, testing information regarding our testing sites and times are available on the ACT COVID-19 website. And today my shout out is to our wonderful Auslan interpreters, Mandy, Cherie and Lauren, who are with us every day to provide this vital service to the community as we work to make sure that everyone has access to all the information that they need. Thank you very much, and I'll hand back to the Chief for questions. And thank you to our Auslan interpreters.
We're happy to take questions.
Chief Minister, one of the central assumptions of the Doherty modelling is the capacity for testing, tracing, isolating and quarantine, and that capacity won't degrade as case numbers increase. We've seen in New South Wales the pressure that system is under. Where does that leave the Doherty modelling in your view?
Well, this was the subject of some really good discussion in National Cabinet in a 3-hour meeting on Friday afternoon. It's clear that we can't base our decisions on optimal TTIQ, that will not be possible with very high case numbers. So we need to look at TTIQ being partially effective rather than optimally effective, and that's a fact. That's something we will have to deal with. So within the series of public health responses that are available to manage the different transitions through the national plan, we'll need to rely more on the public health directions and social distancing and other measures like mask wearing. And our principal weapon is vaccination. So that combination of factors means slightly less emphasis and reality, a reality check that TTIQ will not be optimal. And so we need to use the other two measures to counterbalance that.
And you're confident that the other states and territories are on board with that based on Friday's meeting?
Well, I think that would be the majority view of National Cabinet, but it really is a matter for other jurisdictions to put their own position forward. But the lived experience is that it's very difficult to have absolutely perfect TTIQ when you've got thousands of new cases day after day after day. It just gets impossible.
I had to sort of harp on a theme, but overnight we received even more complaints from people who've been in quarantine for a long time, past their due date. And to be fair, when I contacted those people this morning, or some of them, they had received a call, so I acknowledge that. But it does raise the question, what measures have you got in place to let people know when they can get out of quarantine? And have you set up a system so that people aren't left waiting like has happened?
Yes. So there's a number of ways that people are contacted: email, SMS, telephone. There's a callback arrangement. There's a team of 20 that are answering the phones, and there's a team of 20 that are making phone calls out on the callbacks. The number in quarantine has dropped from over 20,000 to less than 1,000 today. The team worked until midnight last night, I'm advised, and then began again almost first light this morning in making contact. So the advice I have now is that there is about 800 who are still to come out of quarantine. Not all of them will be at day 14. The system issue that was identified before was that there wasn't an exact match between the information that was on someone's test in terms of full name, date of birth. And so if there was a slight mismatch in information across 20,000 people, they may not have put exactly the same information into both systems, then that then meant that there had to be a manual process to then go and assess those individual cases. There were some instances, I'm told, that the email from ACT Health got caught in a spam filter for an individual's email account, and so when they went and looked in the junk mail folder, they found the email there. In other instances, it has required an individual manual process, and that's either been through telephone, SMS or callback. So we're very well aware of the issue. The numbers now are down to less than 1,000 who are in quarantine, and we hope that everyone who's due to receive contact today will receive that contact by way of callback. If they called in yesterday, there will be some more tomorrow who will be released, and some more the day after, and the day after that, and then the day after that, I believe, and then we're really getting down to more like dozens rather than hundreds.
One of the people I talked to said that they had a call and that there was like a process to go through. Can you just explain what that process is?
You need to submit your day 13 negative test, and so proof of that, and provide that to ACT Health. Now that generally can be automated, but there may be circumstances where we need eyes on that to prove it, and that's where there can be a delay in the system. We can provide, and we have been endeavouring to provide, further information in the frequently asked questions area of the COVID website and through social media engagement. This obviously is a very big number of people. It was, as a proportion of the city's population, more than 5% were in quarantine, but we're now down to less than 1,000.
The NBA this morning has announced it has plans for a petition to get smaller construction sites included in the opening up of construction. Are you open to that idea? And will you meet with them as they've asked?
Well, okay, so a couple of questions there. So no, the commencement of the staged re-entry of construction activity starts, as we have indicated, next Friday. There would be a second stage, and that would include residential, but it won't be on Friday. So, I mean, petition all you like. It's not about who signs a petition, it's about the public health situation that we face. So, the NBA are doing their job, they're representing their members, and that's entirely appropriate, just as the CFMEU and the workers' representatives have also been making representations. But it is not about who signs a petition, or who demands a meeting, or who thumps the table that determines public health directions. I mean, if the entire system degenerates into who can shout the loudest, then we may as well all give up and go home. The virus will just spin out of control. So that's not the position that is going to shift the current situation and the current restrictions. What will shift the current position and the current restrictions is low case numbers and the epidemiology of the outbreak coming under control. So can I be absolutely crystal clear on that? I am very well aware, I have had thousands of representations in relation to the residential construction sector. It is our intent, when it is safe, to reopen the residential construction sector. And the quicker we can get to that safe point, the better for the whole community, including the residential construction sector. But my responsibilities extend beyond just the residential construction sector. The MBA's responsibilities are focused mostly on the construction sector. So clearly they will have a view and they will advocate. Of course they will. And that's understood. And I respect that. As I respect the right of anyone to make representations, but I do need to be clear that the decision-making process is not based on who signed a petition or how many mean emails or social media posts are made. That's, if we degenerate into making decisions about the public health of the entire community based on who sends a mean tweet, we're in a really bad space.
On the issue of residential construction, you're saying that that sector will be allowed to reopen once it's safe to do so. I think people are trying to understand, given those projects are smaller, there are generally a fewer people on them, whether that's a public health risk, a risk of COVID transmission on those sites, or is it a risk that there'll be worse compliance than the larger sites? Can you sort of unpack some of that thinking?
It's all of it. So there's a cumulative risk across the community about movement of people. So let's go back to first principles. The reason for a lockdown is to reduce the movement of people and the interaction of people with each other. Principle number one. You then, as you move through an outbreak, have the potential to ease certain restrictions that will then lift the risk profile, but at a manageable level. And where we are now in the outbreak is that we felt able to slightly ease some restrictions, counterbalancing with the increase in restrictions that we applied to the large bulky hardware stores, for example. So there's an overarching question of how much movement is there because the flow-on implications of people going back to work is more kids in childcare, more kids needing to attend school, more movement. All those people who work will duck out for a coffee or get lunch, and there's all of these extra interactions that you have in society. Now, in normal terms, that's great. You want that sort of activity in the economy, but when you are trying to suppress a deadly virus, you'd prefer not to have that. Then we go to the issues contained within the construction industry itself. And the larger sites with larger workforces have demonstrated, not just here, but around Australia, to be more effective in their safety and their COVID-safe protocols, much more effective. We then look at general compliance with all of the other work health and safety requirements that go with construction. And once again, within the construction industry, there is a range of compliance with the law. At one end, you have excellent compliance. Builders, constructors, MBA members who take things safety exceptionally seriously and pride themselves on it. And then at the other end of the spectrum, you have some in the industry who think the whole thing is optional. And I just simply point to the track record of the ACT construction industry in terms of its safety to say you'd think you would understand why the government would have some caution and why this needs to be a stepped and staged process. That's why we are undertaking it the way we are, but that doesn't mean that residential construction won't reopen. Of course it will, but not first up. We take a gradual step forward. There will be further steps that will be taken. So yes, residential construction activity will resume, but not next Friday, the 3rd of September.
Just on, some people are now talking about proof of vaccination before, you know, people can do certain things like, for instance, go to the pub or go to a restaurant. Would you support that in the ACT, people needing to?
Well, consistent with discrimination law, consistent with workplace safety laws, it is not unreasonable for a business to have some of those requirements. I mean, look, there are certain businesses at the moment, pubs and otherwise, that have dress requirements. You can't turn up in thongs and a singlet in certain venues. So to the extent that they then may also wish to have a range of other public health and safety requirements around the operation of their venue, they're able to do that within the current legal framework. But it is not the case, as I think this question has come up every single day in the last 6 press conferences. So my answer is no different than it was yesterday, the day before and the day before that. I realise you weren't at every press conference, Elizabeth, but nevertheless, we can't mandate things when people haven't even had the opportunity to get vaccinated yet. So it's a debate that will be had, but it's still several months away. And it won't be something that the government will be applying blanket across the entire set of social interactions in our society. There may be certain settings where the risk is so high that it would be required, and aged care is one such example where we have done this.
Just on that, when or if will there be public health orders that mandate vaccination for, say, for instance, teachers and health workers? I mean, is that something you could see?
Again, I don't want to speculate on those matters until we are at a point where we've been able to offer vaccination to those particular industry sectors or work. No, I'm not in the business of ruling anything in or out at this point. I know that's you know, it's the favourite question of the journalist: will you rule it in or out? Just not playing those games at the moment. Our focus is on getting as many Canberrans vaccinated as quickly as possible, getting this outbreak under control and being able to take some steps forward from where we are now in terms of easing restrictions. We have a challenge, though. that we can quash this outbreak successfully, and I believe we're on the path to do so. But we are still exposed to a new spark, another wave of the virus coming into the ACT. So whatever we do between now and when we get to the very, very high levels of vaccination that we need, we're going to have to be very careful and measured in our response over the next 3 months, which is what I said a week ago, and it remains the case that spring is going to be difficult because we're going to be balancing a reality that our population will still not be sufficiently vaccinated, and so we will need to have the other measures in place, including public health restrictions and directions in order to protect the unvaccinated.
The vaccine rollout, we've heard the federal government say people hesitant with AstraZeneca can wait for Pfizer if they wanted to. In the coming months, as Moderna and Pfizer supplies continue to ramp up, will the ACT government consider opening those vaccinations to over 60s once everyone else has had the chance to get vaccinated?
Well, I think that would be something that would be considered once the vaccine supplies are there. And so that would be at the very tail end of the vaccination program. I'd also observe that we are well advanced both nationally and locally in our thinking in relation to the booster shot program that is going to be necessary. So really the vaccination program is just going to be one continuous stream of activity. Once we've got to the point that we have fully vaccinated all of the people who want to get fully vaccinated, we're going to have to step almost immediately into doing the booster shots for those who were first vaccinated many months ago. So it's going to be a continuous program of vaccination because it's not just about hitting those 70, 80, 90, 95% vaccination targets. It's about maintaining the level of community vaccination at those levels into the future. And all the evidence from the Northern Hemisphere suggests that the vaccines provide very effective protection, but they do need to be boosted. And so I think we can anticipate, if COVID follows the path of other infectious diseases, that it's with us for the rest of our lives and we will need to have a booster shot every year.
Given the vulnerabilities of community housing, and we've just seen Ainslie be listed now, it's a second complex, what's the government doing to minimise the risk in vulnerable communities like that, and will you consider an in-reach program for other sites? It's
already happening. In terms of in-reach vaccination and in-reach programs, yes, that's already been happening, and I was advised that, for example, the first dose vaccination rate at Ainslie Village is over 70%. So that's a very good level of coverage in that context. So the teams have already been in. There'll still be more people we need to vaccinate, absolutely. And these, amongst other risk points across Canberra and across Australia, are the reason that there's caution about making too many big steps, particularly at 70% national vaccination. The data that has been released shows a very strong correlation between vaccination rates, the age profile of a particular local government area, and also its socio-economic status. So in the ACT, our highest vaccination rates are in the areas of Canberra that have the oldest population, and our lowest areas of vaccination are in the parts of the city that have the youngest population. So the inner south, very highly vaccinated. The inner north, where a lot of students and young people live, not as highly. And so that's all about who's been eligible to get vaccinated. And this level of data is being monitored daily, weekly, and forms part of both our mass vaccination program as well as some of our targeted programs around vulnerable communities.
Just on community service organisations such as mental health and DV support, we saw some money come in the last 2 weeks, I think it was, when it was announced. In New South Wales, we're starting to see an endemic of self-harm, especially for younger people. Will there be any more support or any more measures now that the budget's been postponed for these organisations?
Yes, there already was factored into the budget, but we're able, of course, to bring forward particular announcements and support. So the short answer is yes, absolutely. These things are being looked at. We're managing and monitoring demand across a number of government and non-government organisation support services. We recognise the significant role the community sector is playing in assisting, particularly for vulnerable communities, but more broadly across the entire Canberra population. So it will continue to be a partnership between government and non-government providers, and we will be providing additional resources.
The federal government has today released some new numbers which show the breakdown in vaccination rates in different parts of Canberra. As the vaccination rollout continues, would you consider at all different levels of restrictions in different parts of Canberra?
No, there'll be one set of arrangements for the ACT. We can't get to the point of suggesting that Western Creek and Woden would be somewhat different from the Molonglo Valley, or that the inner north would be different from the inner south. No, it has to be consistent across the ACT. Whilst we do have some small localised variations, we are quite a homogenous community by and large, and we're at 430,000 people are too small to break down into much smaller subsets for different levels of restrictions. It would just be too confusing for everyone, frankly.
So can I just clarify something on Pfizer supply? So we're moving to the AIS next Friday, I think it was, 3rd of September. It's got the capacity for 24,000 a week, which is significantly higher than Garran. When will we see that surge up to its full capacity in terms of supply to be able to reach that 24,000
Yeah, so
a week?
it's an important question, and important people understand that it's got the capacity to do 24,000 a week, but at the moment we're only receiving about 17,000 doses a week. We anticipate that number going to 19 and 21 and then 23,000 a week in terms of Pfizer doses over the coming months. So it's going to be a little while before it reaches absolute peak capacity, and we would be hopeful that by the time we get to that point that we are well through our vaccination program, and that Moderna will also have kicked in to provide another mRNA vaccination option. Now, as I understand it, the dose intervals, the recommended dose intervals are 3 weeks between first and second dose for Pfizer, 4 weeks between first and second dose for Moderna, and at the moment AstraZeneca is the 3-month, 12-week dosage, although in New South Wales they're obviously having to compact that, and they're stretching out Pfizer to 6 weeks in order to try and meet their sort of immediate crisis.
So will we then have Moderna at government-run hubs?
No, Moderna is, we are advised by the Commonwealth, going through the pharmacy network. That's the advice we have to date. If that changes and we need to do Moderna, then we'll look at how we could do it. But our mass hubs are focused on Pfizer, and we've been planning for that ramp up to more than 20,000 doses a week of Pfizer arriving and being able to be dispensed through the AIS clinic.
Despite our figures being relatively good today, Sydney's recorded more than 1,200 again, and also at Cooma there's been COVID fragments found. Is that making you nervous?
Oh, well, almost everything about COVID makes you nervous when you're in a position like mine, having to try and manage all of these competing interests and issues. I mean, just this press conference has covered quite a wide range of detail in relation to the COVID response. So, as I understand the epidemiology of the Sydney outbreak, its effective reproduction rate is in the number of people that each person infects is still more than one. And so we've seen it ratchet up from hundreds now over 1,000, 1,200 today. The expectation is that that number will keep on growing, and it may or may not peak at around 2,000 cases a day. We will see, but it's still got a way to go. Regional New South Wales, our hope is that the New South Wales government's more immediate and clear regional lockdowns have a much greater dampening effect on viral spread, on the basis that they've got into it earlier, and that it's probably easier to contain within smaller communities like Cooma than it is, in a big sprawling metropolis like Sydney.
Just on a sports note,
Right, yes. Sports questions normally signal the end of questions for me, so perhaps if we come to any other COVID ones, then I'll deal with the sports questions and then questions for Dr. Coleman.
So yeah, just one more on COVID. We've seen aged care. Sorry, first of all, can you provide an update on the aged care vaccination status as we reach our deadline to have them all mandated, and then on top of that, when it comes to exemptions for mandates, currently only for aged care, but perhaps into the future as well, is religious exemptions one of the exemptions considered?
Okay, so the last figures I recall seeing were a little over 80% on the aged care first dose, but we'll get an updated number to you. If we don't do it today, then it'll be, because the Commonwealth are doing this, so we're going to get the information from the Commonwealth. But I recall that the number was over 80% now. I think religious exemption, people certainly can claim that as a reason for not wanting to be vaccinated. That still doesn't get you around the fact that you must be vaccinated to work in an aged care setting. But there's still, we've got about 3 more weeks to get your first dose of a vaccine for workers in that context. Now, if I've got any of those details wrong, I'm sure Dr. Coleman will be able to address that, but I'm pretty sure that's right. I'm thinking I'm getting a nod. Yes, okay. A sports question, Elizabeth.
the sports question is, how good is Ahmed Kelly, who won silver overnight at the Tokyo Games?
I didn't watch it, I'm afraid, but I don't have time for sport at the moment. But I'm sure an excellent athlete and a fantastic result. Yeah, look, sorry, I haven't had time, but I will now go and watch the replay. And look, congratulations. That's a very proud achievement to win a medal in any World Championship, and the Paralympics or Olympics is a very significant event. Okay, thank you. Dr. Coleman will take questions.
I was wondering if you could just flesh out the details about the people who are in hospital at the moment, because you said some had left and new ones had come in. Can you just give us a few details?
I'm not sure I remember saying that today, but anyway, I can summarise the 10 people who are in hospital at the moment. As advised, we have 4 of those are under 40 years of age, 6 of those are over 40 years of age, and as I'm sure is not unexpected given what we're seeing in New South Wales and Victoria, all of those cases are unvaccinated.
And how many have now left hospital?
Oh, look, I don't have the rolling date in terms of who leaves and who comes.
And can you provide an update on the total number of so far unlinked cases since the outbreak began?
So yesterday we talked to 16 of those cases being unlinked. This is not a number that I'm able to report on every day because the work does take several days. So we'll probably look to doing that 2 to 3 times a week.
The woman, the ICU patient in critical condition, this has been for a number of days now. Within privacy limits, are you able to give a bit of an update about what's going on, how they're responding to ventilation and the likes?
No, look, we don't provide clinical details on individuals, just to say that she has been in ICU for a fair amount of time and our thoughts are definitely with her family.
Are there comorbidities? Are you able to share that?
No further details.
Just on the Ainslie Village situation, the person who inadvertently went there, was that like a visitor or health professional? Are you able to tell us that? And how concerned are you about there being a spread there?
So this person spent what looks like to be the 25th and the 26th and overnight on the 25th at Ainslie Village. We're currently assessing what that risk looks like, and we're treating the whole site as a potential exposure location at the moment, and that is why we're out there at the moment offering testing to all residents and staff who are on the site. Once we've done a walkthrough and a proper risk assessment about the person who visited or was on site for those 2 days, where they went, how many people were on site, and we have some of those results back from the testing as well, that'll help us understand what the risk is and how concerned we are about transmission. But I think, as we talked about with the Condamine site, this is also very vulnerable people who have a lot of higher level needs and other social factors at play. And I think that's why, as soon as we hear that says there's a potential issue, we jump in with both feet and we are there doing all we can very quickly.
Offering testing, why not make it mandatory given the high risk setting that it's in?
So I'm sure you're aware that making something mandatory with people who don't want to have something done is a really challenging situation. We always go in, as we talked about with compliance as well, we always go in with our communication and education. So that is the starting point. We have had excellent take-up at our Condamine, and I anticipate that we will have excellent take-up here as well.
I understand that argument, but we already have mandatory, day 13 testing, so you can leave quarantine. Otherwise, you get a further quarantine period. Same with some casual.
So I'm sure, as you appreciate, the discussion is about, and the language that we like to use, is that we are offering testing to those who need to have it available. And then clearly, if there are problems and we need to fill gaps, then we accentuate that approach.
I've just got one question. It's something that was raised with me, but from the public again. Apparently last night there was a notice went out saying there's new exposure sites, but when people went to look at them on the website, it hadn't been updated. Was that just a glitch or...?
Yeah, look, I don't have any specific information on that, but just to let people know, there's actually quite a process to go through in terms of assimilating the information from the cases as well as other sources of information. We go through a rigorous risk assessment process before we decide when and how a public site will be located. Sometimes there is a little bit of a timing issue around some of the aspects that need to all come together, including the exposure location on the public form. So apologies if that didn't quite work as we would have liked it to, and hopefully that's fixed in the next update. Thank you.